Hi, Dr. Patterson here, and it's New Year's Eve, and um, as you know, I've done my 48th consecutive fast and completed it. I completed 28 days with much success. One of the things that we talked about was all the physical attributes of fasting, but I didn't talk about a most important thing, which is the spiritual aspect of fasting. And with the fasting, physically, you clear out all of the damaged tissue, the damaged cells, you get rid of the inflammation. The longer you fast to completion, the better it is, the less inflammation that you have in your body. And we always say that inflammation is nothing more than liquid stool in a particular area. So in the case of the pancreas, say for instance, and they always have an itis on it. If you have inflammation of your pancreas, it's called pancreatitis. If you have inflammation of the bronchioles, it's called bronchitis. And so you have some sort of inflammatory name put onto the area where the inflammation is, but it's actually leakage from the gut. And these are the body's response to that. But in terms of clearing that out, that's what the physical process is of fasting. So we had great success with that. And likewise, all of our patients who embark on this, they have great success. And many of them are seasonal fasters. They learned maybe 10, 15, 20 years ago, and they do this annually, or at least when they feel that they need it. But the one thing I did not speak of, and I wanted to leave that last, was the spiritual aspect of fasting. And as you know, the mitochondria is one of the organelles in the cell that we talk about, but there are many other structures in the cell. But my main concern is the nucleus. The nucleus is where the creator, the information and your connection to the creator is. And so all of your information that you have as far as your ancestors, the connection with the creator is in this structure. And so when you clean this out, you have better communication. It's very difficult to communicate when you're weak, when these cells have structures that are deformed, they're not functioning properly, or they may be just taking up space. This is important to clear out. So you have two parts. You have the physical attributes and the benefits from that, and you have the spiritual attributes and the spiritual form through the connection with the creator through the nucleus of the cell. So this is why fasting and praying is essential when you fast. And so I wanted to just point it out. One of the things that I have also is I have a book that I put together for our patients who fasted. I did this about 2011, and I think I did a reprint in about 2014. This is good information that tells you all the details as to why you need to fast, how to do the fast. It's not for patients who are trying to do it for the first time. They need to be supervised. They should do it under medical supervision when you're trying to do a extended fast. And so this is something that I'm offering. You can call until we get it on Shopify. But we're taking phone orders for this here. It's good information, good reading. It's very basic, very simple. And even those who may not be ready to fast right now or embark on it in the near future, this will help you. This is good information, good reading. It's very simple. You take it, you read it, and then if you have other questions, then you call about it. Or you can actually look online. There's a lot of doctors talking about the benefits and the properties of fasting, but this is a very concise book. You take it, you read it, and you make a decision. Okay. The other thing I want to talk about was the fact that we have so many patients who were, as you know, if a patient was hospitalized prior to these holidays, depending on your diagnosis and the condition that you're in, the hospital will discharge you and let you go home and spend time with your family during the seasonal holidays. And so this is a very dangerous thing because they often go back into the environment that actually put them in the hospital in the first place. And I received some calls of patients who, right after 2 days after Christmas, we had strokes and heart attacks. There's nothing I can do about that. You're in the best facility for it. But what happened was these people had pre-existing conditions. They were let out. Not all, a couple were let out. The rest were just a stroke and a heart attack waiting to happen. It was just a matter of time. So we're looking at the fact that people eat too much, too often, the wrong foods. These foods, and I'll explain this in my YouTube video, the reason why you get sick, especially Black people, you're in the wrong location, the wrong area if you trace your ancestry. So um, this is not the area for you to be eating this type of food. And many of the conditions like chronic illnesses that we talk about is related to the fact that you're in the wrong area, eating the wrong food, and then you overeat this food. And this food is processed with a lot of chemicals in it. Your body cannot tolerate that, and you don't have the heat and sun to help support your immune system to be able to tolerate such food. Now, the other thing is that I often wonder why, and I pose this question to my patients, and then those of you out there who are not, but your patients with other doctors, why do you continue to go to a healthcare facility or go to doctors who their uh, basis in which they offer care, the standard of care is symptom diagnosis and treatment, when there's no treatment and there's no cure for chronic disease other than prevention? That's the cure for it, is prevention. And I'm talking about hypertension, you know what it is, type 2 diabetes, cancer, obesity, polycystic ovarian disease, dementia, and NAFLD, which is an acronym for non-alcoholic, non-alcoholic fatty liver disease. I'm sorry about that. But anyway, these diseases are based on the fact that you are eating foods that just simply do not agree with your body, and they accumulate a lot of waste. What happens is that medicines are managing this here, and your body cannot tolerate it. The best way to do it is to prevent it. That's the main treatment, and that treatment there is something that's a lifestyle. So we'll talk about that in the future, but in the interim, there are many of those who cannot possibly do what I've done for years. I have a lot of experience in fasting. Okay, so it's a personal kind of thing for me, but it's also something I put into my practice, which is very therapeutic. And we also get a lot of results with that, positive results with that. But what I'm offering to you is the 10-day healthy inflammation response program. This might be something that you're interested in if you're trying to lose weight. I usually use this program for a lot of obese sisters who are going for the knee replacement operation with their orthopedic physician or orthopedic surgeons. And what happens is that they can't have the procedure because they're too far, they're too heavy, they're overweight, and so they have to lose weight. And with this program, it is 10 days. It's something you do at home. You don't have to come into the office. I'm not taking you on as a patient. It's something that you can do just like you do some of the other programs. You may not be patient. It's something that you can just pick up over the counter. This here, you have a consultation. You call in for the consultation if you have interest in it. And what I'll do is I'll consult with you to see if you qualify to do this program. It's very easy to do. You just have to follow directions. And so they have food in here that you should be eating that'll help turn things around. You have the herbs, you have the shakes. It's something that's really, really good. And what we have is patients who are trying to lose weight to have that procedure done. They do it for 10 days. They lose a few pounds. They go back to their doctor and they can't have the procedure because they still are too far overweight. So they go back, they repeat it. They repeat it for about another 10 days and then another 10 days. And you keep doing that until you get down to the weight where you're acceptable for having that procedure done. And in many cases, what happens is that when they get down to the weight where they can have the procedure done, the doctor says that, let me take another image, because the patients are saying that they actually feel better. They don't have the pain and discomfort that they once had. So that weight actually was contributing to a lot of the problems that they had that sent them into in terms of symptoms, that sent them to the orthopedic surgeon in the first place. So what I want you to do is just give it some thought. If you have some interest in that cause, schedule a consultation. I'll be more than happy to talk with you and consult with you and see if you qualify for the program. It's very much cost effective. It's very beneficial. You don't have to worry about fasting. We take you step by step. It's important that you minimize the types of foods that you eat. We're not going to take you off of everything. We're just going to try to rearrange it to where it's palatable and it's beneficial in terms of the amount of water that's present and help you eliminate as many toxins as possible consuming or eating food. Okay, I look forward to hearing from you. Take care. Till I talk to you again. Have a blessed day.